Vascular liver diseases, portosystemic shunt, and hepatic encephalopathy. The vascular liver diseases are portal hypertension, portosystemic shunt, hepatic microvascular dysplasia, and arterioportal fistula. For portal hypertension, the definition is when the portal blood pressure is higher than the vena cava blood pressure. The causes can be prehepatic, intrahepatic, and posthepatic. If it's prehepatic, it's due to portal vein thrombosis. If it's intrahepatic, it's due to cirrhosis. And if it's posthepatic, it's due to right-sided heart failure or hepatic vein thrombosis. The signs are ascites, hepatosplenomegaly, and jaundice. For portosystemic shunt, there's two types, congenital and acquired. In congenital, it can be intrahepatic in large breeds in the case of Labradors. Here we'll see a persistent ductus venosus. And in extrahepatic, it occurs in Yorkies, and there's a communication between the vena porta and the vena cava. And in acquired cases, it's secondary to portal hypertension. The consequences of portosystemic shunt are the toxins bypass the liver, which causes hepatic encephalopathy. There's also decreased blood flow to the liver, which causes atrophy. In the case of hepatic microvascular dysplasia, the characteristics are its congenital portal vein hypoplasia. The breeds it affects are Yorkies and Cairn Terriers, and the treatment is you need to modify the diet and give a lactulose. This is to help with the increased ammonia. And for arterioportal fistula, the definition is it's an abnormal hepatic artery and portal vein connection. The consequences are portal vein hypertension, ascites, and acquired portosystemic shunt. And for the treatment, you need to do a lobectomy and manage the portal hypertension. For hepatic encephalopathy, this is when ammonia and toxins bypass the liver and it causes central nervous system disruption. This is because ammonia can disrupt the neurotransmitter systems. The types are acute, it's rare and it happens in the case of severe liver necrosis, or chronic, it's common associated with portosystemic shunt or chronic liver diseases. The grades of hepatoencephalopathy grade from grade 1 to 4. In grade 1, there's lethargy, grade 2, there's ataxia, and grade 3, you have seizures, and grade 4, you have coma. In the lab diagnostics, we can see increased ALT, ALP, and ammonia, and bile acids, and decreased BUN, glucose, and albumin. For imaging, we can use a Doppler ultrasound or a CT scan. For the treatment of hepatic encephalopathy, in acute cases, to treat seizures, you give levetiracetam. To treat ammonia, you give lactulose enemas. And you also give supportive therapy by giving fluids and treat hypoglycemia. In chronic cases, you treat ammonia with lactulose, and you give, for dietary, you give high carbs, moderate fiber, and small frequent meals. And you can also give antibiotics in the case of metronidazole and amoxicillin clavulanic acid. And also treat any underlying liver diseases that are causing portosystemic shunt.